Good evening, everyone, and welcome to beautiful downtown Grand Forks. This is Grand Forks City Council's Committee of the Whole for Monday, October 12th. Under item 1, call to order. 1.1, welcome and roll call.
Weigel.
Here.
Dockler. Here. Weber.
Here.
Mock. Here. Kwame.
Here.
Sandy.
Here.
Bean.
Here.
We have a quorum.
Excellent. We got a good agenda tonight under discussion items, item 2.0, COVID-19 update. Mr. Dulitz, good evening. Thanks for joining us tonight.
Council President Sandy and members of the council, I'm Michael Dulitz. I'm the Opioid Response Project Coordinator, normal times, and then I've been working with our COVID data as part of our department's COVID response. We're going to do just a quick update looking at our health officer's dashboard and a couple of other measures. Taking a look at our health officer dashboard for today, we remain in the orange category. Our score is at a 2.1, which is high orange, so in the higher end of orange. We have had a fairly significant increase in the number of average new cases per day, with our rate increasing 36% up to 54.9 new cases per 100,000 as a daily average. Our testing continues to remain strong. Our percent positivity has increased over the past week, and our hospital capacity remains at the yellow stage. I wanted to do the SWOT analysis since that was fairly well received last week. So looking at our strengths, weaknesses, opportunities, and strengths, and threats. So looking at our strengths, our testing program does continue to remain very strong. Our testing rate continues to be above what the state is doing, or right at what the state is doing. So the state testing rate is what should look like a dashed line on there, and it doesn't really look very dashed. So that's the lower line, and then our testing rate is the upper line. We are still holding weekly testing events at UND, which are open to the public and well received by the public, and we are holding weekend testing events every other weekend at UND. Those are open to the public as well. For individuals who are in need of more indicated testing, such as if they're symptomatic, if they are close contact, or if there's another need for it, All True Health System continues to be a great partner in the community, testing people regardless of their symptom status, as well as we have other clinic organizations who are testing as well. Another strength that we have is our deaths have still continued to remain low in Grand Forks County, despite what has been happening in other parts of the state. To date, we've had 14 deaths in Grand Forks County since the start of COVID. Looking at our weaknesses over the past week, there has been a fairly significant change in our COVID numbers. As I mentioned earlier, we've had a 36% increase in the case rate from week to week. So we look at the 7 days preceding the last 7 days, and we compare those two 7-day periods, and that is what makes up that 36% increase. In addition to that, our percent positivity has increased from 4.8% to 6.2%. So we're doing a really good job at testing, but we keep kind of narrowing that gap between our really good testing and the number of cases that we're identifying. We still have we've had this continued issue over the past month and a half of we haven't been able to get out of the orange on our case rate or on our dashboard, and I believe that is due to our high case rate. The cases do weigh high on the dashboard, and so that's what's causing our challenges with getting out of that orange as we remain above 25 cases per 100,000. Looking at our opportunities, something that we've been working on over the past week has been working with the state to try and get better access to some of the antigen testing supplies that the state has been getting allocated from the federal government. So one area that is very promising for us is looking at the Abbott Binax Now. It's an antigen test. So an antigen test, it works kind of similar, way to liken it to be would be like a pregnancy test. It's a piece of coated paper inside of a little plastic cassette, and you put the sample on there, and you give it 15 minutes. You read the sample. It tells you yes or no. It is something that needs to be done with trained personnel, but the advantage is it only takes about 15 minutes to get the results. The other caveat is that it's only FDA approved for individuals who are symptomatic, and getting good results is still operator dependent, so you want to make sure you have a good testing program and are testing the right people, because you don't want to run into the issue of false negatives or false positives. But what that test does allow us is an opportunity to identify positive cases sooner, especially those that are symptomatic, so we can start that contact tracing process sooner, get the individual isolated sooner, get fewer and have fewer contacts for them. This could potentially be of really good value to us during cold and flu season, allowing an opportunity for faster identification of COVID cases. And then looking at our threats, over the past 2 weeks or so, we have been seeing an increase in the number of COVID hospitalizations in Grand Forks County. We've been running the number that's been provided to the state, or that's showing up on our state list, is about 8 cases, active cases per day that are being hospitalized. As of this morning, Ultra reported 17 COVID positive inpatients. So, the difference may be a person that has COVID and something else, or it may be an individual who has been transferred in from another county or has another county of residence. Our rate in Grand Forks County is above Cass County, but is significantly lower than the Burley-Morton area, as well as Ward County or Minot. Also looking at another threat that has been identified is the continued increases in cases in the 60-plus age group. So we are still lower than our peer counties in North Dakota, but what we've been seeing in other counties is when they have increases in the 60-plus age group, particularly when it gets in a nursing home, the deaths do tend to rise. So, we are kind of riding just above Cass County and below Ward County. Ward County had a huge jump this past weekend when they had an outbreak, a very large outbreak in a nursing home that resulted in over 43 cases in the 80-plus age group. Taking a quick look at our comparison in percent positivity. So Grand Forks is running right about 6% for percent positivity. When we compare that to Cass County, we are below Cass County, and our peer counties have been experiencing kind of a higher increase in that percent positivity rate compared to us. Burley-Morton is getting really close to 10%. 10% is one of those kind of concerning cutoffs, because that does kind of indicate, that there is, an even higher degree of uncontrolled spread, and we aren't doing a good job at our testing. So, even with a mitigation type strategy where we're just trying to control the spread of COVID a little bit in the community, they do say that 10% is kind of the cutoff before you should be changing your strategy. Ward County has also been getting close to 10% as well. And then North Dakota has been kind of brought up, particularly because of the increases in our peer counties, not so much Grand Forks. And then looking at our age groups for Grand Forks proper, we have seen the increases primarily in the 20 to 29, 30 to 59, and 60 plus age groups. So our college age groups, our working age group, and our elderly, we still have been keeping our numbers relatively lower in the 0 to 19 age group, or the school age group. And a lot of the increases have been on the higher, or the 17, 18, 19-year-olds in that age group. With that, I'm open to any questions. There are some additional slides included with what I did put online, so that may help provide additional context if needed.
Thank you, Mr. Dulitz. Good report. Any questions for Mr. Dulitz? Mr. Weber?
Thank you, Mr. Sandy, President Sandy. I look forward to the day when you come in and start sharing good news with us. And there is some good news, continues to be our hospitalization rates. However, the current hospitalization rates, those indicate just COVID-related hospitalizations. And my understanding is local healthcare facilities have to maintain availability for potential COVID cases, which is very expensive for local and regional healthcare. Can you discuss that for a moment? It seems relevant to some discussions we'll be having this evening.
Well, Councilmember Weber, I guess maybe another way of providing context would be something that's been often brought up in the meetings that we've had statewide with other public health units and things like that, has been the increase in just the overall increase in need for hospital-related care, and that has been taxing the healthcare system as a whole. And so that does create a bit of a challenge when you try and layer COVID on top of that all. So, we've had healthcare organizations say that they've been seeing, nearly record number of patients needing hospitalization. And then adding that COVID piece on top, if we start, piling on and expecting the hospital to be kind of our alarm bell, we may end up being very challenged with hospital capacity in the short term, and long term.
Thanks. In the meantime, we continue to have some of the best testing rates in the country, and we're fortunate for that. Yes?
Correct. And we are, we have seen some fluctuation in testing result times. We are back down a little bit closer to that 48-hour time frame. When the state is put in a spot where they are trying to prioritize one group, it does kind of slow down the state lab as a whole, because they're used to let tests come in, we run the tests as they come in, we send them out, rather than holding capacity back for, a test to come in from, some corner of the state that has to be driven all the way down there, rather than running it kind of as they come. So, the state's done a pretty good job at, they have kind of their limit, and then we've been adding extra testing capacity on through a lab in North Carolina. Some of our Grand Forks testings have been through this lab in North Carolina, and the result times are actually fairly similar.
Very good. Thank you again. Thanks for all your work.
Thank you.
Any other comments or questions for Mr. Dulitz? Seeing none, thank you, Mr. Dulitz. Appreciate the report tonight. Also, discussion items, item 2.1, Indigenous Peoples Day recognition. Mr. Phelan?
I would defer to Councilmember Dockler.
Ms. Dockler?
I didn't realize that I would be doing this one tonight. So, anyhow, today is the second annual Indigenous Peoples Day for Grand Forks, and so I was just planning on reading the resolution that we passed in the last year to celebrate tonight.
Great, please do.
So a resolution of the Mayor and Grand Forks City Council annually recognizing the second Monday of October as Indigenous Peoples Day. Whereas the City of Grand Forks works to strengthen the Native American, American Indian, First Nations, and Indigenous community by promoting, understanding, recognition, and respect for cultures, and to enrich the community as a whole and support empathy, integrity, humility, good stewardship of resources, fostering fellowship and familial cohesion. And whereas the Grand Forks City Council supports abolishing Columbus Day and replacing said day with Indigenous Peoples Day with the intention of bringing awareness and understanding to the City of Grand Forks' community. And whereas the City of Grand Forks recognizes that Grand Forks was built upon the homelands and villages of the Indigenous peoples of this region, without whom the building of this city would not have been possible. And whereas the City of Grand Forks understands that in order to help close the equity gap, government entities, organizations, and other public institutions should change their policies and practices to better reflect the experiences of Indigenous peoples and uplift our country's Indigenous roots, history, and contributions, as well as truthfully acknowledge the history of actions taken that created the gap. Whereas Indigenous Peoples Day was first proposed in 1977 by a delegation of Native nations to the United Nations, sponsored International Conference on Discrimination Against Indigenous Populations in the Americas. And whereas in 1990, representatives from 120 indigenous nations at the First Continental Conference on 500 Years of Indian Resistance unanimously passed a resolution to transform Columbus Day into an occasion to strengthen the process of continental unity and struggle for liberation, and thereby use the occasion to reveal a more accurate historical record. Now, therefore, be it resolved that the City of Grand Forks shall continue its efforts to promote the well-being of the Grand Forks Native American, American Indian, First Nations, and Indigenous community. Be it further resolved that Indigenous Peoples Day shall be an opportunity to celebrate the thriving cultures and positive values of the Indigenous peoples of our region. And be it further resolved that we encourage our community to explore and acknowledge Christopher Columbus's violent and tragic mistreatment of Indigenous peoples. And be it further resolved that the City of Grand Forks encourages Grand Forks Public Schools, the University of North Dakota, other educational institutions, businesses, organizations, and public entities to recognize Indigenous Peoples Day. And be it further resolved that the City of Grand Forks Indigenous Peoples Day shall serve as an occasion to reflect upon the ongoing struggles and positive contributions of Indigenous peoples of this land, and to celebrate the culture and value that Anishinaabe, Dakota, Lakota, Nakota, and all Indigenous peoples add to our community so as to enhance understanding and promote harmony. Therefore, be it finally resolved by the Grand Forks City Council that the City of Grand Forks shall no longer recognize Columbus Day and shall henceforth proclaim the second Monday of October to be Indigenous Peoples Day. I also wanted to point out that there is a guide that was included in the agenda tonight to explain the tribal flags that sit behind us that were gifted to us a few years ago. Tonight there would have been more individuals here, I think, in celebration of Indigenous Peoples Day. However, they are actually at the Grand Forks Public School meeting tonight, also gifting a set of flags out at the MSEC Center. So that is what they are doing. And I believe that we have an individual here tonight that would also like to speak.
Good evening, Mrs. Kempenich. How are you?
Hello, bonjour. I'm going to take this off so it can be heard a little better. Bonjour, greetings. I am Hillary Kempenich. I live at 1610 Ryder Road. As a member of the Turtle Mountain Band of Chippewa and a resident of Grand Forks of over 20 years, I would like to say Miigwech, thank you to our City Council and to Mayor Bochensky for recognizing Indigenous Peoples Day. Indigenous Peoples Day recognizes and celebrates the role of Indigenous people in our nation's history, both past and present. And it recognizes that we Indigenous people are still here. We are your neighbors, friends, teachers, students, co-workers, employees, classmates, patrons, business owners, laborers, musicians, artists, medical professionals, and so much more. Indigenous Peoples Day is one step to erase invisibility. It creates space for our Native people to share our perspective and amplifies our voices which may normally go unheard. It is a time to honor the achievements of both people within our community and throughout Turtle Island. The National Congress of American Indian states, this change allows the opportunity to bring more awareness to the unique, rich history of this land that is tied to the first peoples of this country. It also acknowledges American Indians and Alaska Natives as thriving, contemporary sovereign nations who hold their rightful place among the American family of governments." End quote. Today is an opportunity for us to acknowledge the reality of our nation's history, honor the long-standing contributions and identities of Indigenous peoples, and fight for Indigenous representation, equality, and justice. Growth doesn't have to end today. I implore our City Council, our government, and our community to continue to explore educating oneself and to create equity within the City of Grand Forks. Thank you. Miigwech.
Thank you. Is there anyone else here interested in speaking regarding Indigenous Peoples Day? Hearing none, any other comments or questions from council? Very good, excellent. Item 2.2, resolution authorizing the issuance, call for bids, and set sale date for 4.695 million refunding improvement bonds series 2020A, 1.645 million refunding improvement bonds series 2020B, as well as bond call 2010B refunding improvement bond. Good evening, Ms. Storsted.
Thank you. President Sandy, members of the committee, as Mr. Sandy has stated, item 2.2 that is before you summarizes 3 bonds that are in front of you. There's one new bond, one refinance bond, and one called bond. The first bond is the refunding improvement bond, which is 2020A. We issue these bonds annually to cover the year's special assessment projects. There are 2 attachments to the staff report that will give you more detail about all 3 of these bonds. Included are the resolutions as well as the pre-summary report. And Paul Steinman is also on the line attending via Zoom, and he will be available after my summary just to give you a little update on how things are looking in the market and pre-sale summary of the bonds that we have coming before you. First of all, though, the proceeds of the refunding improvement bond, they're used to finance various infrastructure projects within the city. These projects get certified, and incoming special assessment payments are then used to make the annual debt service payments. The total of those bonds, as President Sandy stated, is $4.695 million. We look to approve the resolution authorizing the issuance of these bonds, call for bids, and set the sale date for November 16th. Baker Tilly, then formerly Springstead, will then come back on November 16th to go through those bid results with you. The second bond then is the 2020B bond, and that is a refinancing opportunity for us of our 2010 C bonds. We look to use some existing cash in that debt service fund to realize interest savings with lower rates and shorten those maturities with the estimated savings of around $323,000 net present value savings on those. So as with the first issue, we look to approve the resolution, authorize the issuance, call for bids, and set the sale date for November 16th on that as well. And the final bond then associated with this agenda item is the 2010B, as we look to redeem those bonds in full and call those bonds on December 22nd. So what's attached there is a resolution and notice of redemption for approval. With that, I'm going to see if Cheryl has Mr. Paul Steinman on the line, and he is attending via Zoom, hopefully here, and he just will go through that pre-sale summary report that's attached to your staff report and let you know how things are looking in the market as we go for bid. Mr. Steinman, are you on?
Yes, good evening. Can everyone hear me all right?
Yes, we sure can. Thank you.
Super, thank you. Maureen, I'll just hit a couple of high points. Maureen did a great job of going over the summary of the 3 items here. Just a couple of other issues. We'll be in the week of November 2nd in a rating conference with Moody's. As they do each time that you're in the market, they rate your bonds. You're currently rated AA2, and that will happen the week of November 2nd. We'll be in a rating call with Moody's. On your 2020B, where you're refunding bonds, we have projected savings, interest cost savings through that refunding of about $378,000. And we're going to use some of the dollars being put into that refunding to shorten the term of that refunding from 2031 to 2027. So we're estimating good savings there. And also, you're calling bonds, paying them off, and saving dollars there as well. That's your 2010 C, and those savings will amount to about $215,000. So those are the items I'd like to add. And the other item would be, is it a good time to be in the bond market? As you can see on one of the pages of the pre-sale summary, there's a chart there that uses an index called the BBI, the Bond Buyers Index, to kind of give you a visual dating back to 2015 of what rates were like in the market. And if we go to the far right of that chart, we're almost to the lowest point on that entire chart. And in looking back even further than that, the historical average rates for example, a 10-year deal today. The historical average rate dating back to 1993 is about 3.4%. We're estimating here bonds. We have a bond estimate for your new money bonds that is, I'm clicking through it here, that is about 2%. So well below where the historical average has been, dating way back to 1993. So a good market to issue bonds, and thus the reason why we're proposing refunding bonds as well, because you can achieve some savings through doing that. So with that, I'll be back on November 16th to present the bids for your final award of the bonds. And with that, I'll be happy to step back and take questions.
Thank you, Paul, and if anybody has any questions for Paul or I, we're available.
Any questions for Baker Tilly or for Ms. Storstad? Any comments? Mr. Weigel moves approval, second by Dockler. Any other comments? Hearing yes, Mr. Weber.
If I may quickly, the point of all of this is for the city to lend support to Altru's construction efforts. No.
No, that's the next item.
That's the next one.
Correct.
Very good.
This is city bonds.
Very good, thanks. I'm ready to vote.
Okay, great. Any other comments? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries unanimously. Thank you. Item 2.3, resolution authorizing the issuance of revenue bonds on behalf of Altru Health Systems.
All right.
Ms. Storstad.
Thank you, President Sander, members of the committee. This item 2.3 is in reference to the Altru bonds. A request is before you to approve a resolution authorizing the issuance of revenue bonds on behalf of Altru Health Systems and set a public hearing for November 16th at 5:30 here in council chambers. Per state statute, the city is allowed to issue revenue bonds such as this under the North Dakota Municipal Industrial Development Act of 1955, North Dakota Century Code 40-57. The city acts as a conduit, and there is no obligation, liability, claim, or other charge against the city. We have this written for you as part of the documents that are provided in the resolution that is written in more detail as well as in your staff report. Altru is requesting to issue debt under this act, and the proceeds of which would be used to refinance an interim taxable loan for costs of construction. We also have Jennifer Hansen of Dorsey is attending this meeting via Zoom if there are any legal questions related to conduit debt, but I'd like to turn it over to Dr. Weiser, who is here to present on behalf of Altru to go through the purpose and benefits of this financing.
Good evening, Dr. Weiser.
Good afternoon. Good evening. I'd like to say good evening to President Sandy, members of the council, and Mayor. It's my pleasure to be in front of you this evening and talk a little bit about Altru Health System and give you an update and talk through what we're requesting for issuance today. I am Stephen Weiser, President of Altru Health System, effective of January this year. I was the Chief Medical Officer last year, and I was the Medical Director for the hospital since 2017. What I'm most known for is being an ER doc in our community for a very long time. I immigrated from Winnipeg way back when in 1999 and had a small family then and blossomed that out and raised 5 kids, and I have a couple of grandkids now. So I'm a citizen like you and very concerned about our health care, and this is what kind of drove me to adopt and become in this sort of leadership position going forward. We're here to talk about authorizing the issuance of the bonds, and I'll explain a little bit of the background on that. I first wanted to just thank the members of the council, President Sandy and the mayor and his team, in this great collaborative effort we've done together as an organization and as a community. I think one of the things that we can take, despite Michael Dulitz, who I love him, and work really closely with him for a while now, on first starting on the Opium Project, points out that COVID is really here. But one of the big things that we can take, both as a healthcare organization, but more importantly as a community, is the partnership that we've had protecting our community and our region in an exemplary fashion, despite the rising numbers, and I can chat a little bit about that. There's a lot of questions relating to the bond, which I'll walk through, and then I'll also just give you a brief update about where we're sitting as Ultra Health System in terms of our operational performance and our vision of things moving forward. If I may, just to dive into the bond issuance, we're looking to authorize 50 million of revenue bonds. Last year, we took out a short-term bridge loan of $50 million. The intent was post the end of the year with sustained operational performance to convert that to a long-term debt and issue all the financing for the hospital structure. As you know, January, February, and then March more deliberately wasn't nice to the US of A, and we got hit by an unprecedented pandemic that essentially put a cessation of hospital and clinic operations and really deeply affected healthcare. Ultra Health System was no different. That obviously also affected our ability to think long-term in terms of debt allocation, and that's part of the reason that we have sought to convert this at this point in time to a different debt structure, long-term debt, based on our nonprofit status. The initial goal was, as we went through last year, which I was a key part of our operational strategy, is to build up our operations, build up our book of business, which we continue to do, and then be able to seek permanent financing. And the pandemic had a significant impact on us both operationally in order to do that and secure the kind of finance that we'd want, and actually forced us to cease the hospital operations, which are well known, as I've been in front of the media and I spoke to this at several different venues off and on over the last 9 months. What we did do in terms of deciding what was probably the best strategy was engage our bond counsel, which is Ponder and Company. They've worked with Ultra Health System for many years, most recently since 2016. And under their advisement, we had many different opportunities to consider refinancing this. What we felt was the best strategy was the long-term conversion strategy, because it did allow us to take that off and convert that from a short-term debt, which improved our financial status, and convert it to a long-term debt, but also realize the history of this type of debt structure, especially with major projects such as capital building projects in healthcare. It's very common to convert that to a long-term structure. So that is the purpose of what we seek to come to a resolution with you today. If I may, just want to kind of give you a brief update about where we're at. And Michael started off us very classically with what we're dealing with every day, and that's COVID. Every hospital and health system in our region, in our state, in the Midwest, throughout the whole U.S., were deeply impacted. Ultra was no different. We faced a very concerning, potentially devastating financial impact that could have affected us long term. However, the history of Ultra is not one to not take challenges on and adjust to the climate that we're faced with. As you know, and many of you have been in this community, and I moved in this community in 1999, we made it through a flood. In fact, we didn't have any federal support through that, as I talked with Dave about how we managed as a community. And then Ultra suffered a building collapse, and then all the other financial calamities that we've all struggled with. This was another one. It's different than others. It's a biological, ongoing threat. In fact, if we think about where we sit right now, we're not through COVID yet. And, that's a reality. We had an implementation phase. In that implementation phase, we sought partnership with you, the city, the council, our region, institutional partners at UND, the Grand Forks County, Grand Forks School Department, and every other Air Force base. And we developed a strategy to protect our community, and I think we served that indelibly. That didn't come without cost. That vigilance, though, which started back in February, continues through to now, and is a reason where we stand as a community in charge of our destiny in terms of how we're handling this pandemic. If I may make a couple comments, I know that hospital capacity has been an issue and been brought forward multiple times. It's a very complex moving target. There's not a really set way to measure it every day. Your point in time, and at noon can be very different by 1 o'clock, because the emergency room where I work in, you could fill the hospital up in an hour real quick. And what I mean by that, you can have 10 or 12 admits when you didn't have any for a few hours. So very dynamic process. Yet, despite all those dynamic issues, the challenges we have with our workforce staff being exposed, and the testing strategies we've been a little bit handicapped with, we've been able to maintain operations and take care of all of our patients in our community. In fact, over the last 2 months, for you, Councilman and President Sandy, we've been beyond capacity. And what I mean by capacity is just, that's an ER doc's term of where we are. We're just really full. And what I mean by that is our medical admissions, typically from day to day, year to year, prior to this pandemic, would average about a census between mid-140s to mid-150s. For the last 2+ months, we've been sitting between 160 and 195. Most of the time, except probably really this last weekend, we've been managing COVID quite easily in our community, and we really haven't had a very high census. So our impact of our operations of the hospital has never been challenged in terms of COVID. And in fact, even with 17, we're managing that just fine. The real strategy to that is managing your beds and transferring your patients out back to their communities, where 50% of our patients we take care of in this great city come from the regional areas and stuff. So we're working with our community partners in the region, the critical access CEOs and the directors of nursing, to figure a better strategy of how we can offload our critical hospital, which is our tertiary facility in this region, to maintain operations for all our citizens when they're needed. And that's just a little bit of a measure of how we've been navigating through that. So while I wasn't happy seeing that we were at 17 Friday and then 18 Saturday, back down to 17 and now maybe down to 16, those patients are recovering faster than they did prior. They may come in sicker, but they're tending to not end up on a ventilator more often than not. And if they do, this course is very limited. The collaboration that this organization did with Mayo Clinic and Hopkins and other great institutions was practice best practice for COVID, and that practice has changed from day one back in February all the way through now. And I've had colleagues of mine and friends of mine who've been sick, quite sick with this, recover remarkably better than, based on the lessons that have been learned. But this is a work in process. COVID isn't going away, but we're managing it to the top ability. And something that I'm very proud of, and in fact I'd say boastful of, is this health system in your community, my health system, your health system, our community-based health system, which is what All True is, was the first in our state to give convalescent plasma in April, when it hadn't even been given out 16 times in all of the USA. We were asked by Mayo to be part of a strategy, research development that they were partnered with Hopkins and a Texas affiliate that I can't remember the organization's name, if we wanted to partake in studies of that. And we had a very sick regional patient from a community north of us who insisted, hey, I saw this on the media, can we do this? And their family member was very ill, like life-threateningly ill, and had been on a ventilator. And I think because we were able to get that convalescent plasma and then just continue with the great care that we did, we were able to turn him around. And that's I think that's amazing description of what we're committed to achieve here at All True for the city. Going forward, where we've been at, another thing I'm extremely proud of is our ability to adapt. We faced a really serious impact financially, like all organizations. If you recall the Mayo, they talked about losing $1 billion. Some organizations bigger than that, based on cessation of their procedural-based services, which is the operating engine of the hospital. Health systems generate revenue by hospital operation and performance. They do not by the clinic. It may seem counterintuitive, but that's really the reality of it. We had to cease those operations. There was no choice. Had a very strong conversation with the governor, who said, Steve, I hope you're stopping your hospital, and I hope you're stopping your procedures. That was very early on in early March. It wasn't an easy decision, but it was a necessary decision. Faced with that, we knew we had to do a lot of things. One is we had to provide great care, and that led us to our partnership and with the state, with the region, public health, with the city, and we did that. And we pivoted and we adjusted. We also had to do operational impacts, and we did have to affect some workforce, administrative workforce. That's a reality that we had to do based on our organizational size and structure. The goal of that was to maintain our ability to function and operate and provide great care, which we did. We did receive some grant funding, as you're aware, from the federal government. That did help our operations. It was about 5 days cash on hand at each venue that they gave out, and then 1 day, so it was about $26 million. It offset our losses about maybe half. But more importantly, the operational adjustments that we've done now put us in a position where there's a very high likelihood we're going to end with a positive margin at the end of this year, certainly 0 to 1.4. Which in fact, when we look back at where our operational performance was pre-COVID and directly affected by COVID, to know where we're sitting from a financial perspective, that's pretty incredible. And that's again a testimony of what we're committed to do to provide care and maintain ourselves as the organization for this community. A big question I get asked all the time, of course, and I'm a citizen. You got to remember, I'm a physician, I'm a dad, I have kids. I love this community. I care about healthcare. My North Star for you and all and us and myself is outstanding patient care quality and patient care experience. I feel when you do that, the rest takes care of itself. We are a single entity healthcare system. We have 100 plus histories. My intention is to be the best health system in our state, in our region, and Midwest even. And that's what my driving force is. I think when you have that vision and create that, the rest of things will take care of themselves. Part of that is finishing this hospital. To finish that hospital, we have to simply have our book of business in order. We're still going through COVID. We're in a maintenance phase right now. We're not even into recovery phase. And as you saw, per Michael's report, going up to 17 COVID patients in the hospital is no joke. It's very serious still. We don't have a handle on it. And our operations are still affected because despite our turnaround financially, which I'm more than proud of as an organization, we're still down about 18% of patients coming in. That means people are still fearful of coming in and getting their screening and their care. And despite being down that much, patients and customers, it's hard to call them customers, but that's what they are. But they're our patients, they're our community members. We're operationally looking very strong going forward. But for us to resume our hospital, for us to be in the position that you want us to remain in and evolve from, we have to demonstrate a strong operational bottom line moving forward. And we will, and we are. And this year looks great, and our forecast for next year looks even better. And it's a matter of that vigilance. We're guided by one thing and one thing only. We are the health system for this community. We have been for 100 plus years. We will remain that. We will provide what you deserve, I deserve, my family deserves, all of our families deserve is outstanding health care, and we'll deliver that. I understand that everybody wants to have a set time and date, and I'm excited to get to that more than anybody, but I realize my responsibility is driving quality, driving the experience, financially making us sound and strong going forward, and resuming and building that. That to me is the cherry on the top of what we're going to get to, and we will get that and complete that, rest assured, President Sandy and members of the council and mayor. I have colleagues with me here today, which I should have introduced early on, but I'm not usually used. I speak to a lot of people every day, but I haven't been in front of the council before. But my colleague Dave Mullen, who needs no introduction, but he's a legend in himself for this community, and very, I would say that a goal of mine would be to emulate his commitment that he's dedicated to this community at the resolution of my career, whenever that may be. My colleague Craig Faber, who's our CFO, and Tom Tweeden, who's our manager of accounting, are also available virtually. So I'll permit any, if you have any questions for me, I'm happy to address as best as I can, and my colleague would certainly help out as well if needed. So.
Thank you so much, Dr. Weiser, for that discussion. Any comments or questions?
President Sandy?
Yes, Mr. Veen.
Yes. Thank you, Dr. Weiser. I appreciated your report. A couple questions. You said you had 17 cases in Alta right now, but that's well beyond Grand Forks County. I mean, Alta serves northwest Minnesota, northeast North Dakota. So if you were to approximate, how many counties do you think you're actually serving here in Grand Forks, and, or what population base?
Well, yeah, so the clarification is great. I mean, I would say, well, we know it's about 230 to 240,000 residents that we provide coverage for, from northwest Minnesota through the north of Dakota, and then some of the little bit of the south region. It's quite a big area of expanse, and typically, based on our hospital day-to-day census, a minimum of 50% of patients are regional patients from whatever county, whether it's Grafton, whether it's Roseau, Cavalier, Langdon, you name it. So Altru's history has been such that in our hospital census, about 50% of our daily admissions come from outside our immediate county.
Do many of those hospitals, other hospitals out there, have COVID patients, or are just the more extreme patients brought to Grand Forks then?
Yeah, you know, that's another great question, Councilman Veen. So something that Altru has done for years is really worked with our regional critical facilities, and very early on in the pandemic, just as a testament, as our commitment as a tertiary facility for them, we liaised with those CEOs and DONs and made a strategy of what they could feel comfortable taking care of and what we would have to. And a common misperception that, you know, we deal with at the state level, I speak with the governor and his team on this on a regular basis, is our critical access facilities are not designed to handle really complex patients. They can handle patients that have been stabilized and treated and what we'd say turned around a little bit, so their requirements are more basic nursing needs, but they certainly don't have the capacity to handle a very sick COVID patient. Having said that, a lot of them in their nursing facilities have managed those patients for a couple days, and you know, generally speaking, everybody has a fear, especially the elderly, if they get it, they're going to be mortally ill from it, and that's simply not the case. Comorbidities certainly increase your risk, but a lot of these patients do recover. So those facilities in our region do their best, and they'll monitor them for a couple days, but with our liaison with our hospital staff, our critical care staff, we take these patients pretty readily so they don't progress further on, but they do try to keep them there for a day or two and monitor them. And a lot of those patients do end up staying there, even in their nursing facilities. So.
Great, Mr. Green, yeah?
Yeah, and one last one. I think, you know, from my experience, one of the major issues has just been staffing, nursing, respiratory therapists, and the like. It's not just beds, and we seem to focus on beds, but not all the other aspects of it. Can you just describe how you are able to, or where we are at, considering the large area we are in, with maintaining the staffing for these critical ill people? At the same time, you have a lot of others that are in there that could be critical ill for other reasons.
Yeah, thank you, Councilman. So I would say that the bulk over the last 2 months, easily, 2.5, have been patients that are not COVID at all related in our ICU. In fact, our ICU has been full. With regards to staffing, I'm actually pretty amazed, despite the fact that if you ask the mayor, I've been barking to the governor about getting localized testing, regional testing here. And I've even mentioned with Councilman Weber on a few partner meetings way back when. But we're in a position we're trying to make that happen. The reason that's so important is that when we're managing the full hospital, we're running censuses 160 to 190, and that's tight. Yet we're still taking care of everybody. When you have a staff member, a respiratory therapist, a nurse, a tech, an aide, anybody who's exposed, whether they develop the illness or not, it's based on testing, so to confirm. So the sooner we can test, the sooner we can maintain our operations and not have any impact on our beds. This week, yesterday and today, was a big uptick in exposures, community-based, non-hospital-based. Community-based of 30 staff, various staff, aides, nurses, techs, etc., who were exposed in the community are waiting their testing. So that's a 48-hour period or longer, but it's been pretty good. The state's done a phenomenal job, don't get me wrong. We've really valued that partnership. But that implicates our ability to manage staffing around the clock and different types of pivoting for different wards. Do we have enough staff to cover that ward, to fill all the bed capacity? Despite all that, we've actually mitigated this incredibly well, but we would be better served, and you would be better served as a community in our region if the city divested, Thermo Fisher to this community, which we've asked and we're in the process of figuring that out. But that would mean we would do further testing, surveillance testing that Michael reports to, the assisted living facilities that Michael has reported out on as well. But we'd be prepared to do that. We'd have to put the infrastructure in there. But despite those challenges, and that's probably, I would feel, our biggest challenge as an organization on this COVID crisis, and the fact that the business is returning because people put off their care, is the ability to manage our staff, protect our staff, and work and avoid people being sidelined because of an exposure. And I will highlight too that nobody in the hospital, working in the hospital with our mandated PPE structure, has ever contacted COVID from a COVID patient, zero. Something we're incredibly proud of, so we fostered that. You know, I will say though, you know, for all of you who have family members and in healthcare here, to give them a little bit of a pick-me-up, pep talk, and because it's been a real hard grind. This workforce of 3,500 people are hurting, they're tired, exhausted, and there's no end in sight. So we're trying our best to figure out how to raise that up, because we have to keep plugging away, because we have such a huge responsibility that we fulfill every day to this community. So,
Thank
great
you.
question.
Yes, Mr. Weber.
Thank you, President Sandy. We are so fortunate to have a locally owned, locally controlled hospital in our community. The easiest way for people to think of that is at some time in the last year or two, probably most of us, either for ourselves or a friend or family member, have visited Altru. Imagine if we had had to drive to another city for that care. We're lucky to have you here. Thank you. Everyone wants to protect their health, and many are fearful about going to their healthcare providers right now, including being fearful about going to the hospital. Instead, it may be one of the safest places to go to right now. As you've just mentioned, there have been no staff. Could you speak to that for a moment?
Yes.
There have been no staff who have had a positive test.
Nor do we know of any guests who've come to the hospital to visit their family members, develop COVID after being in our facility. So that's true. I mean, something very hard we implemented was a two-pronged approach. One is protecting the facility, protecting healthcare workers, and I'll remind everybody, the members of the council, President Sandy and the mayor, that we had those lights for Altru. We had all this community robust engagement supporting our staff, knowing that it was important, and everybody demonstrated great citizenship. And they continue to. I think they're just stressed about it. It's just been a long haul. And that's the challenge we face, is sustaining this from a community to control the spread and maintaining that vigilance that a mask do help, social distancing does help, and trying to stick by that. So, but we have not, we had tight restrictions early on, and then we initiated a safe start strategy, because we knew we could start, very early on for the first several months of this pandemic, as you might recall, and we didn't talk about our census very much, but anytime I was on a venue, I explained, we went 2 months without a COVID patient in the hospital. And then it started creeping up, and it stayed and hovered pretty low, 5, 7. That's what I've been telling my institutional partners, colleagues. And then just over in the last week, and I'm not sure why it took a bit of a spike, I expect that to come back down. The county numbers are starting to come back down.
Good.
But a lot of this is behavior, sports, families, grandparents going out to watch football, the football teams, soccer's not on right now, but I guess volleyball, other sports, so that seems to be a bit of a nidus. But when we did our Safe Start, what we did was we partnered with Mayo and got 500 plus tests a week on a separate note, separate from the state, so we could test any patient who needed a procedure. Because we felt it was very important that surveillance screening, cancer screening, all those important things that people need to get done for their lives could get done, but they have to be started in a safe process. So in collaboration with Mayo as well as the state, we figured out a cadence to pre-test everybody coming in. So we were not putting ourselves at risk or our staff at risk, because you can imagine if your facility shuts down and you can't do emergency surgeries because you don't have enough surgical techs, surgical nurses, PACU staff, etc. It's so important, and that's another measure of caution that we instituted very early, and we carry that on to this day. We have that not perfected, but again, it's a pretty efficient process that we have that's allowed us to build our operations back up again and helped our financial performance, no doubt. But I still, I'll just harp on it, I really want the state to cut us loose regional testing, because I think Altru has demonstrated its ability to be a regional site to protect 230,000 citizens very effectively and do a conveyed message with institutional partners led by the city council and the mayor of how important it is. And if you look at our city and how we've managed this compared to the other cities, there's a tremendous amount of pride. I feel that every day.
Fantastic.
And we just have to keep moving it, so keep on point, so.
Very good. We have some numbers that are a little worrisome. You're optimistic that we're going to see some of those come down. But in the meantime, if you've been putting off that test, that checkup, that screening, this is a good time to come to Altru and get that work done, yes?
Yeah, we've been open for business in a safe fashion since May 25th was our opening Safe Start strategy were implemented. So we were safe prior to that too. I mean, we just restricted visitor access, whether it's coming to the ER, but if you had a stroke, a heart attack, whatever ailment you had or a trauma, you were taken care of in a protective fashion throughout. And as you recall, because it feels like eons ago, we had a sick clinic established where patients with symptoms would get screening to avoid them from going to the standard clinics, and we directed that in the COVID hotline, which is over 40,000 calls. It's just, it's been a great strategy that we've done in our collaboration with you in terms of how we protect this community from a real high-level public health perspective.
Congratulations on all that, and thank you for all that work. This plan of having the city help with the bonding, this is not new. This is something that we've been contemplating since the beginning of the construction project. What else is Altru doing to assure the success of this important construction project? Is it just the city's support, or what else has been done? You've mentioned some cuts and other changes. Anything financial that we should know about?
I think it's, we all are aware of what happened with our bond rating, as an example. As we show our fiduciary responsibility and show our operational performance, that's what our position is. We have to maintain a positive bottom line, which despite a pandemic, we look like we're going to show that. We have a forecast for a 3 to 4% margin next year with an EBITDA 10 to 12%. And we believe with all of our operational improvements, which we've established, and I wouldn't call the reduction in force and operational improvement. It was something we had to do from a workforce-related issue, but all the other strategies in terms of efficiencies and how the hospital is run, contract management, there's about a list of 20 different areas that we work on. That gives us our strength, and the proof will be in how we sustain that going forward, and that is how we will gain our strong foothold and be able to go and get the rest of our financing.
Thanks for that clarification.
So,
yeah. Good. Just a couple last questions. Can you give us some sense of what this would save Altru, this collaboration with the city? And I want to make sure both what's the savings for Altru, what is the cost for the city? Or the risk for the city. So that's maybe a question from Historistad, but if you could give us an idea of the benefit for Altru, first of all, of this arrangement.
Yeah, so I'll if Craig is on or Dave, I'll let them handle the fine time numbers. I'm an ER doc, so I do know numbers, but not as good as them.
This is Craig Fairber. I am the interim CFO. And as far as saving us money, what this really does is allows us to take this short-term loan, which is actually due at the end of November, and turning it into a long-term, a 15-year borrowing. And so what it does is just extends our cash flow for this $50 million. And I know the attorney's on for the deal, and as they mentioned earlier, it doesn't create any risk for the city, and it doesn't cost the city anything. But this would be very helpful with our long-term financing to extend this from a few months now to 15 years.
Very good. Thank you. Thank you, President Sandy.
Thank you. Any other comments or questions for Dr. Weiser?
Move approval.
Mr. Weigel moves approval. Is there a second?
Second.
Second by Mr. Veen. Mr. Phelan.
I just wanted to say a few comments about all that Ultra's doing, and I think this impacts their bottom line, but they still did it. Some traditional things that would be probably done by a community in their public health area, and then we had meetings with Ultra on this, is, they've operated a COVID hotline, which is a function that they've done on behalf of the community that is not a reimbursable expense. They've done a lot of curbside testing for folks that, again, a lot of that is not reimbursed. So when you talk about having a community-owned hospital, they've stepped forward, and if we didn't have Ultra just stepping up to do those things, we would be presumably using some of our CARES funding and some other funding to do that, but Ultra stepped up and just did it. And I think the other thing with the institutional partners, sometimes you meet with institutional partners, and maybe you don't get the A-team, but every time we meet with Ultra, it's Dr. Weiser, it's Mr. Molman, and whomever is on their top tier on the decision-making every week, so we really are impressed by that. And I think the other thing, I think we should all be impressed by the financial turnaround. The fact that they're going out to the market currently, right now, is a really good sign that they're doing well. And I would suspect, Dr. Weiser, you're just an ER doctor, but there must be a lot of demand for these bonds because they're going out to the market. So just on behalf of the community, I think those are all great signs. And they've even absorbed some expenses that are not being reimbursed because of this, and really helping to support the city. And filling niches that we didn't serve, or we would have had to step up, President Sandy.
I think it's easy to take your health system for granted. You assume they're always going to be there, and when you're not feeling well, you can just call the hospital or make an appointment or show up in the ER. I think the most important thing that Dr. Weiser said to me today is to thank all the men and women that work in our hospital system, because you're right, the stress that people have been going through these days is unprecedented. And I know for one, I take our hospital for granted. I'm sorry I do that. I really appreciate that Ultra is always there for us, and I appreciate all the people, the good people that live in our community that work there. So thank you very much. There's a motion and a second on the floor. Any other comments? Yes, Ms. Ma?
Do we have ongoing communication between like the mayor's office and Altru to know if he would ever get into staffing issues or have capacity concerns so that we know in real time if we have an issue?
I'll say we do.
Yep, we definitely do. We have scheduled weekly meetings, but there's also as-needed types of meetings, and so I can recall, I would say in a recent history where there were some concerns leading up to the weekend and what was going to be happening, and we get calls from Ultra just so that we're not the last to know, we're the first to know, and so that we can share it with important leaders in our community too. So that's an ongoing thing, and it's remarkable that we have this relationship, and it's a mobile phone call away.
The other question I have is, do you have that type of relationship with other hospitals in the state? So do we take patients from Bismarck knowing their numbers are so much higher, and would they take our patients if we had that issue?
So healthcare is really complicated, and that's a fantastic question, Councilman. We've, for years, leave COVID off the table. Our hospital is near doc. Sometimes we're full capacity in our critical care patients or med-surg patients or trauma types of patients. So we often transfer inter-hospital area within our state. We share that resource, whether it's with Minot, whether it's cross-state to Bismarck or Fargo. More commonly, it's Fargo. So we've, surprisingly, you'd think a big facility like they have couldn't fill up, but they do, and they've sent patients to us. It's been a cross-collaboration. That's just really what healthcare is. And, more importantly, recently in discussions I've had at the state level and working with Tim Blazel as well as the NDHA and Chris Jones is, we need to understand our full bed capacity of the state. It's a utilization problem, not a capacity problem, which means that we have to have the A game across the PPS facilities, which are what I would refer to as our tertiary facilities. But our critical access facilities need to be always ready to take patients and maintain that staffing, because that's how you allow, when you're at capacity, to offload certain types of patients that are healing. A pneumonia patient, you don't need to be in the hospital for 2 more days. They can go to that facility is a classic example. But we do cross-share and collaborate, absolutely. So.
Great. Any other comments? Questions? Hearing none, all those in favor signify by saying aye. Aye. Opposed, same sign. Motion carries unanimously. Thank you so much.
Thank you so much for the opportunity.
For coming, thank you. Item 2.4, applications for NDDEQ's 2020 Volkswagen Settlement Emission Mitigation Program. Ms. Dorstad, good evening.
Thank you. President Sandy, members of the committee. The agenda item that you have before you is regarding the Volkswagen Emission Mitigation Funds settlement. This is approximately $2.7 million that's become available for the state in 2020 for eligible items. Chief Lorenz will come up here and speak in a little more detail regarding these settlement dollars, but just briefly, we look for approval to apply for these dollars to be used toward needed equipment in our fire and streets department. This does come with a match of up to 50%, so we wanted to bring this forward for approval of council first before making our application, which is due November 6th. We do have funds available in our capital reserve to cover what would be our expected match of this needed equipment replacement. Determination of recipient should be known by year end, and we can report back to you. But I'm going to turn it over to Chief Lorenz. He'll give you a little more context.
Evening, Chief.
Good evening, President Sandy, members of the council. As Maureen stated, what this is settlement money that was awarded, not necessarily awarded, but delegated to the state as part of a Volkswagen settlement where they had lost a court case about emission standards. So it awarded a lot of money to the states, $8.7 million in North Dakota. This is year 2 of this allotment. So the intent is it has to be used to repower or replace vehicles to improve emission standards. And by applying for this funding, we are hoping to continue to improve the department's fleet, both operationally and environmentally. Specifically for the fire department, the vehicle that we would replace is a 1996 version. There are specifications under the application guidelines. It can't be older than 93. And it isn't just a matter of replacing it and you sell it. You have to demonstrate by drilling a 3-inch hole in the block and cutting the frame rails in half. So it needs to be decommissioned if you're going to accept the award. It is up to 50%. There's $2.7 million this year. It depends on the number of applications. But it would help us to continue to move our fleet forward. It has a double benefit because we have a 1975 aerial out there as well that if we move forward with this project would also be removed from service.
Great. Any comments or questions? Moved by Veen, second by Mock. Seeing no other comments, all those in favor signify by saying aye. Aye.
Aye.
Opposed, same sign.
Thank you.
Motion carries unanimously. Thanks, Chief. Item 2.5, Grand Forks Public Health sole source purchase of a trailer. Good evening, Ms. Swanson.
Good evening, President Sandy and members of the City Council. You have before you a request from the Health Department. It was prepared by Dustin Johnson of our Regional Emergency Response Program. And this is a request to use a sole source purchase for a trailer. The trailer would be utilized for possibly COVID testing in mobile locations, as well as what we anticipate would be the greater need would be vaccination efforts. We know that we will be planning a number of those things in the next year. This would be a unique opportunity for us to secure this type of equipment while we have CARES funding available to do so. You have before you the two, not bids, but quotes for the items, and we are looking at the less expensive one, which is a total of $23,067.45. And we would request your authorization to move forward with a sole source purchase for this item. It has all of the necessary things, and the Health Department also has a vehicle to tow it with a proper towing package already purchased.
Great. Any comments or questions? Moved by Mock, second by Weber. All those in favor signify by saying aye. Aye. Opposed, same sign. Motion carries unanimously. Thank you. Item 2.6, agreement between Grand Forks County and City of Grand Forks for school nursing services in Grand Forks County schools. Ms. Swanson.
Yes, President Sandy and members of the council, you have before you an agreement for services to be provided to county schools. For a little bit of history, Grand Forks Public Health Department has provided different types of school nursing services for many years. We know that Grand Forks city schools are served well by school nurses that they have in place, but the county schools have relied upon the health department for some very intermittent services. When COVID happened this fall, they recognized that was a very big gap. 2 county schools went out and hired their own staff, and when the county came to us offering funding, we saw that there was a need to make sure that all county schools had an equitable situation for school nursing services. So Grand Forks County did award us funding for 2 nurses to cover the remaining 4 schools, which are outlined in the agreement. We have prepared an agreement, a service agreement that's been approved by the county already. It was prepared by the state's attorney, and the city attorney did have an opportunity to review it and make edits to it. It is for a 1-year period ending September 30th of next year. And I would be happy to answer any questions regarding the agreement or the school nursing services.
Any comments or questions? I thought the agreement was quite straightforward. Moved by Weber, second by Dockler. Any other comments? Hearing none, all those in favor signify by saying aye. 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 Opposed, same sign. Motion carries unanimously.
Thank you.
Thank you very much, Ms. Swanson. Item 2.7, request for a driveway variance, 1800 47th Avenue. So, Mr. Grasser, good evening.
Good evening, President Sandy, members of City Council. This request came to us on behalf of the owners of the Edgewood Development Complex. If you remember, this is down right off of 47th Avenue South, between 20th Street and Cherry. So the request, if you remember, a large part of this complex is an assisted living facility. Associated with that is also going to now be a office, medical office, which is essentially a satellite clinic. Part of the services that they want to offer there, and part of the equipment that they need is going to be a mobile MRI unit. This unit that comes in is essentially an over-the-road truck type of a facility. It's a large vehicle. When they added this here in the last couple months, they looked at the site and found that that truck couldn't make some of the turns, essentially, to get into the location that it needed to be to operate. So one of the solutions to that, they did some minor site modifications, but they also needed a wider driveway. The minimum driveway width that they need there is about 45 feet. The city engineer has the authority to go to 40, and beyond that it goes to City Council. So we recommend approval of the additional driveway width out here, 45 feet. It's actually located right off of, let's see, 17th, I'm trying to remember, 17th Street, so it's not on 47th Avenue South. Turning radiuses are in your packet.
Any comments? Mr. Weber moves approval, second by Mr. Weigel. No other comments? All those in favor signify by saying aye. 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 Opposed, same sign. Motion carries unanimously. Thank you, Mr. Glasser. Have a good evening. Item 2.8, project update for Project 8237, state and federal funding summary. Mr. Krenko.
Good evening, Council President Sandy and members of the council. This staff report, it's an information-only item, and this is going over the various grant programs that are out there and various federal funding and state funding programs. We've got grant season coming up, and so this is an overview of the various programs out there. If you end up looking at the back of the packet, there is a map that'll kind of help describe some of the first few programs I'm going to go over. First being the Regional Roads Program. This is used for what is considered a regional road. These are roads that are under the jurisdiction of the North Dakota Department of Transportation. This is going to be your U.S. Highway 2, your Demers Avenue from the interstate to the river, North 5th Street, a number of those locations. Funding on this one is typically an 80-20 split, federal and state. If it's on a primary regional roadway, which would be US 2, or if it's on a secondary regional road, such as 32nd Avenue, Washington, it would be a 80 60% federal, 10% state, 10% local. These projects are typically going to be your rehabilitation, your reconstruction projects, that sort of thing. The urban roads program is kind of the next step, and those are going to be the classified roadway system within the city, which we end up deciding a lot of times as to what rehabilitation projects or reconstruction projects we're looking at. For this program, we typically get about $2.7 million a year in federal funding. Kind of think of it as going into a checkbook, and we can save up a couple of years if we need to on a larger project and apply for them accordingly. Upcoming project that's coming to mind for this, under this program, would be the Columbia Road Reconstruction Project, which is going to go from the overpass to about University Avenue. And this split is typically an 80-20 split for eligible items. Third program is going to be your Urban Grant Program. And this is your, the Governor's Main Street Initiative, revitalizing downtown. This is another 80-20 split with a focus on downtown. That's going to be the area located in yellow on the map. And once again, it's typically an 80-20 split for eligible items. We end up seeing probably a 30 to 40% local costs on these because of the ineligible items. Or sorry, 30 to 60%. Misspoke on that one. Next one is the Highway Safety Improvement Program. This is more of our safety projects. This is going to be kind of our large 32nd Avenue left turn lane realignment project that's going to be coming up next year, for construction next year. This is typically a 90% federal, 10% local. And unless it's on a regional roadway, then we can end up looking at less if it's on a primary roadway system. This is geared more towards safety projects, whether they're high crash or if they're projects that are listed under the local road safety program, kind of like the red light confirmation indicators and the retroreflective back plates. The Rail Highway Safety Improvement Program is the next, and that deals more with at-grade crossings. This is another safety improvement one, which is another program, which is a 90-10 split. Fairly simple, straightforward on that one. It's pretty much at-grade crossings. The Transportation Alternatives Program, this is the one that is typically an 80-20 split for construction projects. In the past, we've been using this as funding for shared use path projects, but we've also used it for rehabilitation of historic granitoid pavement as well. This is a 80-20 split, but it's for construction costs only. So on this program, it's a little bit different than the other ones in that only construction costs are eligible. This program also has a maximum funding allocation of $290,000, and it's also a competitive grant program as well. So you have to apply for it. It goes up against other programs or other projects in order to receive the funding. Typically, when we end up doing one of these projects, we're looking at probably a 35% to 50% local cost on the overall project because of those additional costs that are ineligible. The Special Road Funds Program, this is for construction and maintenance of access roads that go to and are within tourist and historical areas as well as recreational. In the past, we've used this program for reconstruction of Lincoln Drive and Euclid Avenue within the Lincoln Drive Park. This program is a 60-40 split where it's 60% state and 40% local. And this is an interesting program because once you get the funding and you get the go-ahead for it, you then construct the project, you cash flow it, and then you end up asking for reimbursement afterwards. So that is one thing to keep in mind with some of these programs is their financial aspects do differ a little bit, and there are some additional requirements on some of them. The Recreational Trails Program, this program is administered through the North Dakota Parks and Rec Department and is eligible for funding on both motorized and non-motorized recreational trails. This program is designed for construction and land acquisition, as well as design engineering and construction engineering services. and it is for 80% federal and 10% local. The interesting thing with this piece is that when you are awarded funding under this program, you have 18 months to complete the project, and this is once again you end up asking for reimbursement, I believe, afterwards. With this process, or with this program, it is a very, very short timeline from when they open up the funding to when they close the funding window. So you have to get an application in, you pretty much have to have your project ready to go, shovel ready. Last program I'm going to talk about tonight is the Better Utilizing Investments to Leverage Development, or the BUILD program. This was formerly known as the Tiger Grant Program, and this is a large-scale grant program. This is geared towards your large-scale infrastructure projects, rail transport, freight, port projects. This is a nationwide competitive grant program. Though with this program, it is an 80-20 split. Because it is a competitive grant process, it is seen as being more competitive if in the application process you end up offering a higher local share as part of it. Additionally, with this, in order to get your application in, you pretty much have to have all of your environmental documentation already done and a good portion of your design work pretty much taken care of as well. This is another one where it needs to be shovel ready in order for you to apply, which means a lot of front end work. Once again, kind of similar to the special road fund, this is one where we would have to cash flow this project and then ask for reimbursement at the end of it. Kind of the table that you'll see in the second to last page is kind of a breakdown as to the various programs that I just went over, what's eligible, what's ineligible, what your nominal federal share is, your nominal state share, and what your nominal local share would be. And then at the last column is what our anticipated local share would be. As you can kind of see from a number of these, even though our nominal shares may appear to be very good up front, what it actually turns out to be in some cases is maybe not as desirable or higher than what would be identified in the nominal share. Overall, this is an informational item for tonight. Upcoming Committee of the Whole meetings, we're going to be bringing more detailed items forward under the individual programs themselves for applying for these various funds. If there's any other questions, I'd be happy to answer.
Thank you, Mr. Krinkle. Any questions about the road funds, yes, Mr.
Just one quick one. Under the Railroad Highway Safety Improvement Fund, does that include pedestrian rail improvements like 55th Street and Demers Avenue?
Unfortunately, the language on this program is fairly vague, but I can definitely speak with the representative at the North Dakota Department of Transportation, Jim Styron, and find out if a program like that would be included.
Okay, thank you.
Good question, Mr. Veen. Any other comments? Hearing none, thank you, Mr. Krinkle. Have a good evening.
All right, thank you.
Appreciate that. Item 2.9, agreement with UND for maintenance of aesthetic features installed under Project 8042, University Avenue reconstruction, Cooley to Columbia, and medians and streetlights, Cooley to 42nd Street. Mr. Walker, good evening.
Good evening, Council President Sandy and members of the committee. Last year, we began a project to reconstruct University Avenue from Columbia to the Cooley and then rehabilitate University Avenue from the Cooley to 42nd Street. At the request of UND, numerous aesthetic features were included in the project that we wouldn't normally include in such a project with a city project. Those aesthetic features included urns and planters, landscape plantings, pedestrian lightings, aesthetic lighting, so irrigation system, brick pavers, communication infrastructure, ornamental fencing, and banner arms, and other aesthetic elements. The cost of these aesthetic items were special assessed to UND at their request. And so what you have before you is an agreement wherein UND is going to be maintaining those aesthetic features at their cost, and the city is then going to be maintaining the streets as they normally would under city policy. The agreement before you has been drafted by the city attorney and has been reviewed by UND Council, and it's our recommendation that we approve the agreement with UND for the maintenance of the aesthetic features installed under this city project.
Any comments or questions? Mr. Weber moves approval, second by Dockler. Any other comments? Hearing none? All those in favor signify by saying aye. Aye.
Aye.
Opposed, same sign. Motion carries unanimously. Item 210, preliminary engineering agreement for City Project 8265, new stormwater pump station 186 at Vale Circle. Mr. Walker.
So after the September 2019 rainfall event, Council approved an agreement with WFW to evaluate different options to reduce flooding impacts in the area of Pump Station 188. That includes the area of Vale Circle and Glen Circle and Westward Acres. The study revealed that constructing stormwater holding ponds, which is one option of controlling flooding, was not a feasible option at this location, and that the recommended method of reducing flooding in this area was to construct another pump station in that area and then install an additional force main. The study also concluded that there's about an equivalent of 20 acres that flows into this area during large rainfall events. And so what happens is that water overland flows into these low areas or backs up through the storm sewer system. Some of the low areas of Vale Circle, Glen Circle, and Westward Acres are approximately 7 feet lower than adjacent ground, and as we know, water flows to the lowest point. To explain this project a little bit, I'll just go through a few slides that are included in your staff report. This first area that you'll see, if you could dim the lights, includes an area bounded in yellow. Or to the west is Columbia Road, to the north is Demers Avenue, to the east is Washington Street. If I can zoom out a little bit here. And to the south is 32nd Avenue. Most areas within the city drain to the river or to the English Coulee through gravity drains. There are some areas in the city that drain through pump stations. This particular area that's in yellow is one of the areas that drains through pump stations. There are 3 pump stations in this area. It's approximately a 2 square mile area, and the pump stations are shown in green. They pump through a force main that is shown in this pinkish line. We've known that this area, for whatever reason, is not designed to current standards, and it backs up more frequently from large rainfall events. If I go to this next drawing, it shows the proposed improvements that we would do under this project. There are 2 existing pump stations that we're looking at, this pump station 182 near 20th Street and this pump station 188 near Westward Acres. Both of those pump stations are on 11th Avenue. They both pump into a 48-inch force main. That's the line shown in red, and it discharges into the English Coulee. It used to extend through the All-True campus on 11th Avenue and discharge directly into the English Coulee at that location. However, if you remember back in 2018, we did a project to relocate a force main around the All-True campus. We replaced that 48-inch force main with one that was 72 inches in diameter, theoretically increasing the capacity by twice as much if we can get the water to that point. So this project would construct a new pump station near Vale Circle area, this pump station 188 shown in blue, and would construct another parallel 48-inch force main that would connect to the 72-inch that we installed in 2018. we would then have two 48-inch force mains instead of one on 11th Avenue at that location. We would then install a secondary force main connecting from Westward Drive to the existing pump station at 20th Street. That's the one shown in green. That would be a 36-inch force main. That would allow us to put in two additional pumps at the existing pump station on 20th Street. Back in about 2007, we rehabilitated that station and increased the capacity of the station so that we could add two additional pumps. We couldn't add the two additional pumps at the time because the force main, the 48-inch force main that existed, was maxed out at that maximum capacity. So by adding this secondary force main, we have the ability to turn that three-pump station into a five-pump station and significantly increase the pumping capacity of the system. If we were to look at the amount of ponding that we have in this area during a 5-year rainfall event, and remember that a 5-year rainfall event is the standard that we try to design our storm sewer systems to now if we designed a system, the amount of ponding that we would expect to have in this area is what's shown in blue here. That's with the system that we currently have in place. Once this project is complete, we would anticipate the ponding would look something like this. We may have a small area on 7th Avenue, small area on 25th Street, and a small bit of ponding on Bale Circle, but it would be significantly improved. So, the agreement that you have before you is to do some of the preliminary design engineering work. The intent is to get started with the surveying and some preliminary layout of the site and the force main and identify land acquisition needs and things like that. It's suggested that we fund this engineering agreement with city-only funds before we create a special assessment district so that we can better identify scope and cost and that type of thing. The other advantages of starting this preliminary work is that if we, as we apply for grant funding, if we have some of this work already done, it is more likely that we'd be successful in obtaining a grant than if we were to start from point zero. Final design engineering work and construction engineering work isn't included in this agreement, but we would add that by addendum should the project proceed forward. So this project wasn't anticipated when we did the budget in 2020. So it would be proposed that we would use monies from the stormwater budget that are unspent at the end of the year, or if we need to, do a budget amendment to cover the cost of this agreement. Preliminary estimates for the entire project for the new pump station and the 48-inch force main are about $6 million, and the cost of the 36-inch force main and adding the two pumps at the existing pump station is about an additional $1.7 million. The intent is to apply for grant funding. We've been in conversations with folks from Bismarck and working with them on applying for FEMA funds that might be available nationwide. And we're working with them to try to secure funds for this project going forward. With that, staff's recommendation is to approve this task order agreement with WFW for preliminary engineering services in the amount of $93,300 and approve any necessary budget amendment.
Mr. Walker, Mr. Bean, any comment?
Yeah, thank you. Yeah, I appreciate the study and the work that you've done on this. It's been problematic for a lot of years. Many maybe thought it was fixed a few years back, but obviously the recent floods in the last couple of years have really shown that more work needs to be done, and I think you've engineered a great solution for this. It's expensive, but the alternatives probably would have been much more expensive. So I think, and the idea of going after grant money is a great idea too, if we can move this far enough along now to get it better identified, the costs and the plans put together. So I think it's a great project, and I'd make a motion to approve.
Moved by Veen, second by Weber. Any other comments? Mr. Weber?
It's kind of a naive engineering question. How is it that two 36-inch or two 48-inch pipes don't overwhelm a 72-inch pipe?
Because it goes by area, and you can fit more water through a 72-inch than you can.
Pi r squared, okay.
Yep.
Very good, thanks. Yes, very good. Ready to vote.
Any other comments? Any other math problems? Hearing none, all those in favor signify by saying aye. Aye. Opposed, same sign. Motion carries unanimously. Thank you. Item 211, industrial wastewater rate for 2020-2021. Ms. Parvey.
Good evening, Mr. Sandy, members of the committee. Tonight, we're here to ask for a reduction in rate for Simplot, JR Simplot. And the reason we're doing that tonight is we've been working over the last couple months while bringing Red River Biorefinery online. We are looking at the capacity of our wastewater treatment plant and the allocation of our loadings within that. So we were able to step back, look at what Simplot was currently using within their allocations in their permit, and be able to be creative with a team of professionals. We came up with the the plan to be able to reduce their allocation. But in that discussion, we also looked at the cost of service and what that allocation would actually mean for them. So currently, they're charged a rate of $2.62 per 1,000 gallons for wastewater. And if we did a reduction in their allocation, we're looking at $1.94 per 1,000 gallons. We'd like this to be effective tonight, if approved by council next week, and then that would go through the end of December, or the end of next year, 2021. We will continue to work with Red River Biorefinery, JR Simplot, and our wastewater treatment plant facility planning over the next year. Actually, we plan to bring the facility plan back to City Council in the next few months and have a discussion about what we need to do there to be able to continue to support both industrial users, larger industrial users, as well as future.
Great. Any questions for Ms. Parvey? Comments? Yeah, Mr. Veen moves approval. Is there a second by Monk? Any questions, Mr. Weber?
Simplot is a fantastic economic driver in our community, a citizen, industrial citizen. Help me to understand again, you probably just said it and I didn't understand it. Why are we proposing to cut their rate right now?
What we're looking at, Mr. Weber, is the fact that Simplot actually has an allocation that's greater than what they're currently sending us for wastewater, but within city code as well as design capacity for the wastewater facility, we're only able to allocate a certain portion to each facility. So we've actually been meaning to discuss this with them for some time, although haven't needed that allocation until Red River Biorefinery came online, and then needed a little bit more capacity within those allocations. And the allocation capacity that I'm talking about is the BOD, that biological oxygen demand, the TSS, the TKN, and those parameters that we need to monitor. It's that more strength, that has that stronger strength, wastewater that takes more resources for us to treat, chemicals, electricity, etc. So that's really kind of a challenge. We've got so much capacity within the facility, and I can kind of bore you with all the numbers if you want. Mr. Sanders saying no,
but... Let me try this reframe. Instead of it being a cut, we're currently overcharging them, and we would just want to bring this in line with what...
Actually, each year we do the cost of service based upon what they're actually sending us.
Okay.
Their permit is larger, so instead of, right now, they're currently at a permitted value of, like, max capacity for day at 34,000 for their BODs. And what we're suggesting is we go down to like 18,000, because that's really more in line with what they're sending us. So we're just looking at right-sizing their permit for what they're currently sending us. And working with them to make sure that they can work within those allocations, as well as what Red River Biorefinery can do as well.
Thanks for restating all that. That helped me. Thank you. I'm ready to vote.
Great. Yeah, Mr. Weigel?
Just real briefly, what will happen if or when they go over their allotment that they have? I know Red River Biorefinery, we just discussed that heavily. My question is do we have a plan in place so when this does happen, it's not continuing to come back to the council to make a decision on whether they get a break or not?
Councilman Weigel, absolutely, that's one concern that we do have that they've expressed to us as well. Within these parameters that we're talking about changing currently, they're well within meeting those parameters. They could have a bad day, but even if they have a bad batch to discharge to us, they're still over the parameters that we currently have. But it might be a tool that we can use to work with them, so those surcharge rates aren't astronomical. We don't want to have to keep coming back to you to keep adjusting that, so we're hoping within the discussion of our wastewater facility plan and working with advanced engineering and the North Dakota Department of Health, we can also look at some capacity, some opportunities for capacity at our lagoons that we currently have too. So we're kind of still working through that. It could still happen, and I think that's a concern of Simplot. But with that would give us the ability to be able to be business friendly for both those industries while we continue to refine what might be best long-term for us as a community.
Does industrial wastewater have an impact on residential wastewater?
Essentially, there's a pool, and there's residential wastewater is a component of that. So I can, if it'd be helpful, I can send those graphs on.
Just dump into the same pool, essentially?
Yep. Okay. It's stronger, but it takes up more capacity. So then the residential component of it is like a third, if I'm remembering the numbers right, and then, our industrial users are about 2/3 of that. But I can share that breakdown if that would help to explain it a little bit. But there is kind of that pie, and everybody gets a piece of that, but that includes everything.
I guess the one big thing that I worry about is we're reducing rates, which I have no issue with if we're looking to be business friendly. But I also worry about the citizens of Grand Forks and what they continue to pay for water rates. So if reducing this one is causing this one to go up, are we really doing the right thing? And I think that's one thing that we should be cognizant of and be looking at.
Absolutely, and sorry, did you want to answer that one?
Mr. Phelan?
I think Council President Sandy, and I think Melanie's done a great job. I think what we're doing here is that Simplot is being gracious a little bit, and they want something in return. They're going to give some of their appropriation to Red River Biorefinery. They don't want to give it away permanently at this point, but they're willing to reduce their permit capacity, provide that to Red River Biorefinery, to give them some of their pie, if you will. And so it's really between these two industries. I think Simplot is still contemplating, because certainly we want Simplot to grow and expand too. But they are willing in the meantime. They want to do it 3 months at a time, just because they want to kind of forecast where they're at too. So I think to Simplot's, they're providing a big benefit to Red River Biorefinery by granting them some of their permit capacity through us by doing this.
So essentially the money that Simplot is not paying, Red River Biorefinery will be paying. So there's really no loss.
Yes.
Absolutely.
Yep. And I think President Sandy said we're kind of nearing our max of what our capacity is. So now we used to have a lot of capacity, but we've had some significant industry in Red River Biorefinery. East Grand Forks came. Red River Biorefinery gave us more than we ever anticipated. But now, as I think the important part of this master plan is that we're looking to re-rate the wastewater treatment plant, meaning that we have more capacity than when we originally designed, but we need to prove that. So hopefully we can drive the capacity up there a little bit so that we can forestall further expansions of our existing plant. So we're at the point now we need to just start shifting the capacity. Before, it really didn't matter that much as we move forward. But I think the important part with Simplot is they don't want to give it all away now, and we want them to grow and expand at their current footprint for a long time to come.
Any other comments? Hearing none. There's a motion and second on the floor. All those in favor signify by saying aye. Aye. Opposed, same sign.
Aye.
Motion carries unanimously. Thank you. Thank you, Ms. Parvey. Nothing else on the agenda for the night? Anything for the good of the order? Mr. Weigel?
Motion to adjourn.
Move to adjourn, second by Ms. Doppler. All those in favor signify by saying aye. Aye. Motion carries. Adjourn. Thank you.